Light.
Hi, everyone. I hope everyone's staying nice and warm today.
Yes.
Great. I see our health and wellness chair is here. Hi, Neri. How are you doing? Whenever you're ready to start. Whenever you're ready to go, I do have the recording started, just so you know. So I have the agenda on the screen as needed, okay?
Alrighty then. Hi, everyone. Good evening. It's 5 o'clock. We will call the meeting to order. First up is approved agenda as presented. If I could have a motion.
I'll motion.
I'll second.
Thank you, Lisa and Penelope.
You can call me Penny.
Penny. Third is approval of the minutes from last meeting in October. Feels so long ago. May I have a motion for that, please?
Make a motion to approve the minutes.
I can second them.
Who had the second?
Did Lisa?
Lisa. Okay, so Sarah and Lisa, thank you so much. Moving on to community and school updates. Welcome and introduction. So at this point, if everyone could just briefly say, their name, title, if they're on a committee. So I'll go first. My name is Diagnelis Garcia, Neri for short. I am the chair of the Health and Wellness Committee. And glad to be here.
I'm Sarah Dinklage. I'm the executive director of Rhode Island Student Assistance Services and co-chair with Dana Bennett Johnson of the Social Emotional Health Subcommittee.
Thank you, Sarah. Sola, you have control over the screen? Can we minimize the agenda for this portion, please?
Okay, of course.
Thank you. And then just a quick reminder to everyone, if you are not speaking, please mute your mic. Thank you. So we just heard from Sarah. Thanks.
I'm Kelly D'Angela, Sustainability and Student Engagement with Sodexo. And I am I attend regularly the Nutrition and Physical Activity Subcommittee.
I'll go. I'm Penny Pear. I'm a social worker in the Outer District team in Providence School Department. I'm an ESSA point of contact for the district, and I'm also a co-chair with Lisa on the Healthy Relationships Subcommittee.
Hi, everybody. I'm Lisa. I'm the Director of Community and Education Programs at Sojourner House, and I co-chair Healthy Relationships with Penny.
Hi, I'm Karen Wetherill, co-director of Rhode Island Healthy Schools Coalition, and I participate in all of the subcommittee meetings, both healthy relationships, physical activity and nutrition, and social emotional learning as I'm able to.
Hi, everyone. I'm Paula Paolino. I'm from URI, the SNAP-Ed program. I'm a registered dietitian, and I take part in the Nutrition and Physical Health Subcommittee.
Hi, I'm Lynn Conca from Sodexo, and I am operations manager for the elementary schools. I take part in the Physical Activity and Nutrition Subcommittee.
I'm Rosemary O'Brien. I'm a health and wellness specialist at Neighborhood Health Plan.
Am I the last one? I'm Rachel Newman Green. I'm Deputy Director of the city's Healthy Communities Office, and I'm co-chair of the Nutrition and Physical Activity Subcommittee.
Hey, I'm Soullight Sue. I'm the Wellness Coordinator for Providence Public Schools. Welcome, Rosemary. I don't believe we've met in person or virtually, so thank you for joining our meeting today. I believe we also do have one more person, and that's Aaron. Hi, Aaron. Could you make a quick introduction, please?
Yes, hi, I'm Aaron Leonard. I'm the operations manager for the secondary schools for Sodexo for Providence Public Schools.
Awesome. Thank you so much. Hope everyone's ready for tomorrow, whatever that's going to look like. All right. So now we'd like to see the agenda again. Please, Soullight. Thank you. All right, so do we have any comments from the community or guests? Okay. Next is a presentation from Sodexo in their metrics report.
Yes, that's me. So I'm going to share my screen. Bear with me one second. This is Kelly. I'm going to share a PowerPoint. Share. Can you see it?
It's loading now, Kelly.
Okay. And I just need to, oh, I'm sorry. This is not the one. Okay, so can you see it now? Providence Public Schools Health and Wellness meeting today? Yep.
See ya.
Okay, great. So thanks everyone for having me. I want to run through this agenda to give you guys an update of where we stand as of right now after the first 3 months of school, September, October, November. So I'll go through those highlights of the quantitative and qualitative metrics. I will highlight Thanksgiving meals in particular, walk through some of the local procurement metrics, then do a quick section on looking forward, and I'll be happy to take any questions. So qualitative and quantitative metrics, these are the formats of the reports that the ad hoc committee has asked us to regularly provide. Monthly reports presented quarterly or at every health and wellness meeting. So you can see on the right hand side, there's the quantitative metrics that we've organized. And on the left, you'll see just a snapshot of what I've done for the qualitative metrics to answer all the questions posed. So I wanted to start by giving an update of meals served in September, October, November. You can see that obviously we started this year in mid-September, so the counts are lower, but you can see in October, we served, 176 and 177,000 breakfast and lunch meals. We also started the snack and dinner programs at that time. And you can see in November, the numbers climbed significantly. So we have overall large totals for the first 3 months that increased significantly with each month as we expected. I want to bring your attention to some of the challenges that we're facing this year. Namely, obviously about 6,000 students are in the virtual learning academy, meaning they're not in school. So that represents a significant number of meals that we're not able to serve in those schools every day. At the very least, breakfast and lunch. So that's been a big challenge for us. Another challenge is the average about 800 students that we estimate to be in quarantine per day. So obviously those are also students that are not able to accept meals in person, which has impacted our participation rates. But in order to address these challenges, one of the things that we've done is the grab and go multi-day boxes. For September, October, and November, you see we had significant participation in those grab and go meals that include breakfast, lunch, dinner, snack, and weekend meals, and they're served on Tuesdays and Fridays at 8 locations. So again, adapting to the challenges of this year, we have implemented different service models to meet the needs of each school. For example, we have 24 elementary schools. We've had to do classroom service, but we have started some very successful hot lunch pilots that we're going to expand in the new year. High schools, we're doing cafe service, and then middle schools, we have a mix between classroom and cafe service. We've also expanded service in addition to the in-school. I've also mentioned the grab and go sites. as well as take-home service. So we have snacks available, and we're also providing secondary school students with meals for the AB service. So if kids were coming in on Monday, they'd also get a take-home bag with meals for Tuesday. So those are some of the expansions we've done. I'm going to jump to something that I've put together for the Physical Activity and Nutrition Subcommittee to align with our metrics on menu development. I've asked Paula Paolino to give a brief introduction, so I'll let her speak quickly on this.
So for those of you who are new to the committee, I just want to mention that I began a discussion about improving the nutritional quality of the breakfast items served at elementary schools last January through the Nutrition and Physical Health Subcommittee, and also presented my concerns at the larger Wellness Committee meeting. This came up after many complaints I had heard from teachers and school nurses. The major complaints with the breakfast items were basically breakfast pastries, which were high in sugar and carbs and highly processed. There wasn't enough protein or fresh fruit on the menus. Some teachers had reported that the kids didn't feel well after eating them, and they were losing instructional time by making frequent trips to the nurse with stomach aches, or in many instances, they were refusing to eat the food. So myself, Heidi Hetzler, who is my SNAP-Ed colleague, Carrie Lynn Viscioni, who's a first grade teacher at Asa Messer, and Solite, we had a meeting with Sodexo in February, and we've made some really good improvements since then. So there are fewer breakfast pastries, more protein, more fresh fruit, less chocolate, which Kelly's going to talk about in more detail. I'd like to thank the Sodexo staff for continuing to collaborate on improving the breakfast items despite all the challenges they've had to provide meals to PPSD students and families during the pandemic. I just want to mention that the breakfast items of concern that have been on the menu do meet the Rhode Island nutrition requirements. But surprisingly, there are no sugar limits on these products at the federal level. The CACFP guidelines for pre-K have stricter guidelines. For instance, they don't allow chocolate or candy coatings or flavorings. So oftentimes in the past, the pre-K kids were being served something that was healthier than the elementary kids. So we've made a good deal of progress, but I feel there's still room for improvement. Namely, we'll be working on the cereals that are still being provided to the elementary kids, which I feel is still too high in sugar. And there's been a long-standing problem with perception. For instance, Frosted Flakes cereal is still being served. This is a product made specifically for food service that contains some whole grains, so it meets the Rhode Island nutrition requirements, but it's different from the Frosted Flakes cereals that you can buy in the supermarket. So a child or parent feels that, oh, if my kid is getting this at school, it must be okay, and it must be fine for me to buy at home. So I've suggested a sugar limit. We're working on that, and this guideline would align the sugar limit with the CACFP standards, which is also aligned with the WIC standards. And in closing, I know that we want to give kids breakfast foods that they'll like and they'll eat. However, on the Wellness Committee, I feel like it's our responsibility to do what it states in our mission statement, for all students to have access to high quality, nutritious meals so they are well nourished, ready to learn, and able to develop and practice healthy eating behaviors. So I look forward to continuing to collaborate with Kelly and other Sodexo staff members on this. We have another meeting coming up in January.
Thank you, Paula. Yeah, so we put this together to quantify some of the work that we've done based on that original meeting, and to continue through the Physical Activity and Nutrition Subcommittee. So you can see the changes we've made. I've done a red, yellow, green schedule. We've had to make some adaptations because of the COVID crisis, but we have made significant progress, and we want to kind of continue to meet and exceed expectations and address the concerns of the community, and especially of the district, of course. So our goal is to kind of present a well-rounded menu to our students, and our path forward in working with SNAP-Ed and the other interested parties is to basically collect survey data to make sure that our menu and any changes in menu development are student driven. So that's a quick highlight on that. Thank you, Paula. As I go forward, I want to highlight, as I mentioned, Thanksgiving meals. So we had a record-setting week at the end of November. We served 233,982 meals, so almost 234,000 meals, including special Thanksgiving boxes from the district. 1,000 of those that featured local lettuce from Gotham Greens. Our local purchases for Thanksgiving were, as you can see, over 93,000 pounds of food. And they included apples, butternut squash, potatoes, and the lettuce that were grown in Rhode Island, as well as bread and dinner rolls produced in Rhode Island. So I want to mention that in school, we served 20,000 meals on that day, and our multi-day meal boxes provided over 212,000 meals to students. So you can see that there were different meal boxes covering 7 days, 5 days, 6 days, and they featured local produce, including potatoes and butternut squash from Quantitative Farms in Portsmouth, as well as apples from Belltown Orchards in Connecticut, delivered by our vendor Rock's Fresh Foods. So this was a huge operational output that we've done. So we, thank our operations team and the frontline staff for making this happen. Jumping ahead to local procurement, I wanted to show a snapshot of October. So Rhode Island grown, harvested, and landed produce came from Pezza and Confreda Farms via Rock's Produce. We spent, over $10,000, and local produce accounted for 13% of our total Rock spend for the month. You can also see here our locally produced items included bread from Khaleesi, breakfast items from ICM, as well as Shri. And then we also have some regional produce. If we look at November, I've highlighted the Rhode Island grown, harvested, and landed. Obviously, this included the Thanksgiving meals, and local items accounted for 29% of the total items that we received from Rocks for the month of November. So we're very proud of the local purchasing that we've done to date, and it's something that we will continue going forward.
Hi, Kelly. This is Aaron. I just want to add one thing. If you go back to the last slide.
Sure.
The Pezza, just so I highlight this in case people don't know what that means, is there's a farm in Rhode Island that dedicates acreage to grow specific food just for Providence, and they meet with us in the winter and they choose their seeds at that point and they grow it, and come fall we're able to harvest and use that produce that's specifically grown for us. So it's a really unique situation that we have and benefits a lot of people.
Thank you, Aaron. Yeah, that's our longstanding partnership with Pezza Farms, and we reference it as our Adopt a Farm program that we're hoping to expand to other farms as well. So I did mention Gotham Greens. It's a company that we're going to work with as well for our holiday boxes, and we're hoping to continue to partner with going forward. I know this is a lot of information, but I'm gonna click forward here. So holiday break meals. We had, as I mentioned, we had a huge turnout for our Thanksgiving meals, and so to prepare for the holiday, it's an even longer break. Especially now that schedules have been adjusted. It was originally, I believe, going to be 11 days of food, and so that might have been expanded. We submitted order forms for students to try to get like an accurate count or at least a preliminary account of how many students would be doing that pickup from our grab and go station. So that should be very successful. We're planning local produce to be included in those as well. And we're expecting, I believe the count was, the estimate was 400,000 meals expected. I'm not sure if that has changed. So Erin, feel free to weigh in if you have more information. I wanted to highlight our engagement plan of all of the kind of student engagement things that we're going to be doing going forward. I included some things from October, November, December. We did like a little lifesaver teacher appreciation gift that said thank you to the teachers for all that you do. And going forward in January, we're going to be doing a Vote and Be Heard campaign for elementary schools, trying to gauge student interest in some of our meal items and maybe facilitate some menu changes. In February and March, we're going to be doing a Meet the Chef campaign for our cooking schools. We're hiring, I believe, 6 new managers who will be overseeing 2 schools. And so they're really going to be able to engage with students and do some fun activities. So we plan like a Meet the Chef event, student tastings, as well as that survey component for February and March timeframe. There'll also be a pilot of the student advisory teams with Providence Student Union. And then in April, we usually do a Meet the Chef campaign for, our Future Chef campaign for the younger students. So these are tentatively on the schedule, and we hope to bring you more as it comes closer. That's what I have, but I'm happy to answer any questions.
Thank you. Any questions from any of the committee members? I know a couple of people joined a little later.
Kelly, I have a question. So there was a month-to-month increase, September, October, November, in the total numbers of meals served. And what was that attributed to?
Kelly, I can answer that if you want.
Sure. So I think, as I mentioned, September was only like half a month, and kids just coming back. I think as kids got more comfortable being in school and as things like evened out, more students ended up participating rather than, I think a lot of students were bringing lunch at first, but also, our options expanded during that time. So I think students were more able to participate, and students also became aware of the grab and go option. So I think there were a lot of factors contributing to the increase. And then of course, the Thanksgiving meals distributed in bulk in November meant that, more kids were getting a higher number of meals in one setting. So like in one day, they got a bunch of meals. It was only one point of contact, and it was very easy for them to get the meals for the next, 5 days.
Yeah. And we also started the take home. It was a gradual, the take home in the secondary level schools.
Hi, this is Karen. Just a question. So well, first off, let me say that this is really helpful, the way you presented this. I wasn't really sure how you were going to when we were developing the metrics. So thanks for putting it together in a way that was easy for us to understand, both on the engagement and what you're serving and the local purchases. So that's just a comment. But my question is, what percentage, so you showed the growth in the numbers of meals served, but as a percentage of meals served last year, I'm just wondering what still is that gap? And it's everywhere. I know it's very hard, but we know that there still exists an unmet need of food insecurity in the city. And as I say to everyone, these are federal dollars, right, that are available. And I know there's great philanthropy and there's work that people are doing. I actually just saw a GoFundMe today. I think it was at Hope High School for folks that are looking to raise money to provide food and gift cards to families. But this is funding that's federal dollars that are coming in. And I think it's also a connection with schools. So I'm just wondering, first off, what is the percentage difference? And if there's been just thoughts to how to increase that, getting more families able to access the meals, and what do you think those barriers are? I know obviously communication and that they understand that they are still available, or I wonder about, I know in other districts too, it's like when is it available, and are families available to come pick up meals at the time, and is it, are we looking at other methods to make sure that families are able to have access to these school meals, whether it's, multiple meals at one time or the daily meals.
Yeah, so I can speak to that a little bit. First of all, I hope this was like easily palatable. I didn't know how I was going to present it either, but if there's something else that you guys would like to see next time, of course I can adapt. But this being the first time, thank you for your patience. As for the percentage served versus last year, I don't have that in front of me right now, and I know it's something I discussed with our finance manager, because it's so skewed because of number of students in school right now, and that number can fluctuate wildly day to day, week to week, especially because of quarantine, like entire classrooms being quarantined at different times. So it is really difficult to measure this year versus last year, or a normal year, you know what I mean, quote unquote.
But I think, to Karen's point, that would be really helpful in helping us understand what the gap is, like who's getting missed, what the need is. So that would be, not understanding that it's very difficult and not being a judgment on your work, just understanding who normally gets meals and is not right now would be really helpful to know.
Okay, I think that would take some more work and some more information that I would have to get. And so I'm happy to connect with you after, because it would have to be like, participation rate, the underlying numbers for participation rates. So like number of meals versus number of students in school. So I have to follow up on that. But I also acknowledge your point, Karen, about making sure that families do have access to the meals even when they're not in school. Yeah.
Right. And I think that's, yeah, exactly. Because I think we're going to be looking at, well, we don't really know what's it going to look like in January when are students able to come back in person. So we may be looking at a longer time of distance learning, and what can we do to address that there's still continued needs for food in those families. And I'm actually just wondering, I don't know, I don't think we have any school nurse teachers on, or maybe this is something to bring up with Donna O'Connor, but I know in another district where it's happening everywhere, right? The percentage of students who are accessing school meals are much less, as you say, because they're not in the school building, but it doesn't mean that there's less of a need in the community. And one of the things that we were doing in another district is that when students, and these numbers have been rising, who are on quarantine, that when the nurses send the information home to families about what are the requirements, what does it mean to quarantine, that they're actually then getting a specific notice there from the nurse to say, please be aware that, meals are still available. It may be challenging for that family to leave if they're all in quarantine, but then thinking about what can be done. So if you have a family, I know that the state has done some work there too, but just thinking about how, again, the school meals might be able to be provided, and to remind them that even though your student is at home on quarantine, that you still are able to have access to school meals.
Good point.
And Carrie, I don't think you need to get too deep for starters. Like if we could just have, I don't think the numbers of students enrolled in the district has changed substantially since last year. So I think just basically having the numbers of meals served compared to last year would help us at least understand what the meal by meal gap is, and not get too deep into attendance and all that stuff, because that's a lot.
Yeah. Okay. Gotcha. Okay. Yes. And to Karen's point, that's something that I've worked with the school district communications department on. And so we have to circle back, because there's a strategic communications office that, has certain channels to access families as far as text messaging. And so I'm hoping to be able to utilize that to get that information to parents, but it'll have to be a collaboration. And I also just want to show, they did provide this flyer for us in English and Spanish about our grab and go program. So it's Tuesdays and Fridays, 2:30 to 4:30. There's one location, Feinstein at Broad, where the pickup time is 11:30 to 1:30. getting this information out to families is going to be vital. So obviously we want to continue to make that information available. And there are also the city rec centers has, you know, a certain small number of meals available as well. So I think it's going any kind of promotion that we can do to make sure that this information is right in front of families will help.
Yeah, I just want to say, like, this looks great. I love it. It's the right amount of text versus like graphics. I think that looks really good. I'm just wondering, again, I just quickly saw that 2:30 to 4:30. I don't know. Is that a time where parents are able to get to the pickup center, or is it, and I know you can't solve all of this, but I'm just wondering, you know, and is it just that one location, Kelly?
Now, can I jump in on that, Kelly, please? No, we have 8 locations throughout the city. And that's what, you know, it's still difficult even at this time. We've been doing this since throughout COVID, all the sites, and we still have a lot of people that don't have that information. So whatever we can do to communicate that out, you know, we send flyers. I've seen in the city do PPSD do postings on Instagram, but we could do more. And we also sent home the holiday boxes today for all the elementary schools. Over 3 days, we packed out food that went home with all the elementary students that were in attendance, and we also put flyers in those bags so they were aware of the 8 site. All the middle schools are open, and Broad Street is open, and PCTA as well. So whatever we can do to, you know, help facilitate getting that communication out more and more. But I do feel like we have the 11:30 to 1:30 at Broad Street. We have a consistent set of people that go there, but the 2:30 to 4:30, we need that one because a lot of people come after work, and that meets the need right now. I don't know that we can expand it any more than that because it kind of gets dark and it's a little difficult after that, especially this time of year.
Is that flyer that I saw a little while ago on Providence's website?
I'm not sure if it's there right now. That is something that I asked the comms department to update. Yeah.
Yeah, I think I saw it on Instagram and I saw it on Facebook, but I don't know if it's on the site.
I'm not sure if it's on the site just yet, Penny, but what I can do is request that Kelly send an email to us and we can forward it to whoever we need to on our end. It would be great if we can reach out to the social workers, Donna O'Connor, and the school nurses, like Karen said, and we can distribute it that way with the latest information on that flyer that Kelly shared with us.
Thank you, because I'd like to send it to our out-of-district schools. So thank you.
And if you do have the flyer and you do send it to me, Solite, then I can send it to the social workers and psychologists in the district.
Sounds wonderful. For Kelly, for Penny, who works with out-of-district teams, out-of-district students, I just wanted to ask a clarifying question. Would the students in those schools be able to grab the meals through the public schools distribution as well?
Yes.
Okay, great, wonderful. So we'll follow up on that, right, Kelly? And I'll send it out to everyone. Thank you.
All they need to do, Solite, is to have a proof of being in a Rhode Island school because we're running under the summer food service program.
Okay, thank you for clarifying that.
So I just wanted to point out some additional comments that were in the chat. Lots of good words. Shouting out this great presentation that we just saw. Could we make sure that this presentation and any other presentations are either added to the agenda for folks that want to participate ahead of time so they can see it ahead of time, and also added to the minutes, or one or the other, but somewhere where it's accessible so that when people come back to these meetings, they can see what the work is actually, what work is actually happening. So thank you, Kelly, for that. I have just a couple other questions, but I think I should follow up with you and this committee offline because it's already 5:34, and I know some people have to leave right at 6. Are there any other pressing questions regarding this presentation? Okay. So
I'm sorry, I do have one question. What kind of proof would a student need or a family need from an out-of-district team to say, out-of-district school to say they Providence students?
Anything, if they're not a Providence student.
No, they are a Providence student. They're all Providence students.
Oh, if they have a schedule or if they have their ID number, we'll take either one.
Oh, okay. Thank you.
Yes, they are Providence students. Yeah, that's important.
We'll make sure we get the ID.
Thank you.
Okay, so we'd like to hear from our committee chairs or subcommittee chairs. I don't know which one goes first. The agenda's not up.
I can go.
I was going to ask if Penny wanted to go first because she has to leave at 5:50. And actually, they are first: physical health and nutrition.
Oh, Penny's actually on the Healthy Relationship Subcommittee. So if you don't mind flip-flopping for the sake of time, we can definitely have Lisa and Penny start first.
Go ahead, Lisa.
All right, I just need to unmute. Yeah, so we met yesterday. It was a small group of us that that were there. We basically just kind of checked in about our goals for the year. The biggest ones being that we identified that we wanted to review and look at the health curriculum for Providence School District. We wanted to be able to make recommendations for the curriculum and for professional development. We also talked about using Karen's evaluation tool and doing some kind of survey or needs assessment for the district on the curriculum. And then we also discussed potentially working and ways to increase our membership. So right now it's a small group. It's also kind of a crazy week, but we're hoping that more people will join us come January. We are going to be writing a formal letter to Donna O'Connor requesting formally to see the health curriculum. So that way there we're able to make a formal recommendation, in terms of like what we think next steps should be. But we want to make that formal recommendation. Right now it's not accessible to the public. And so we're also going to ask that it's, accessible to for people to be able to see.
We have the like a syllabus for all of the grades and what they're supposed to be taught, but there are textbooks that are referenced, and so we just want to get access to that. So we'll just be talking to Donna.
Yep. Then our next meeting, Penny, do you know when our next meeting is? It's January. Hold on, I'll look it up. Sorry, I should have that in front of me. It is January. It's the third week. Sorry, y'all. It is the 19th. So January 19th is our next meeting. If anybody's interested in attending.
Surprise! Surprise!
Thank you. Any questions from the group?
Sounds like you have a little one asking questions.
So one of the things we kind of realized was a hurdle at the moment is that the prior conversations around the school health needs assessment did pinpoint some areas that we had to address regarding the current curriculum. We haven't been able to move forward with that because the strategic planning that is meant to follow up hasn't actually occurred just yet. I know that Ellen is on here. I was hoping that she could maybe give us a brief update on what's happening with the strategic planning for the school health needs assessment so that we can better guide this particular committee and offer support any manner that we can.
Hi, everyone. Thanks, Solite. So the update is that we still don't have a city budget. Our fiscal year 21 budget is still not passed for the city, and therefore the strategic planning dollars would have come out of our fiscal 21 budget. And so we're not able to move forward with that yet. And I know the school district is also challenged by the city and the state not having passed budgets as well. I think looking at state politics, I'm hoping that the state will pass their budget in the next few weeks, which would then domino us to hopefully have a passed budget, fingers crossed, in January. And so then the next steps would be to RFP out the services for strategic planning.
Right. And I know we had some conversations around working with whoever the Department of Health identifies as the person that's going to work to create their curriculum. And the question was asked yesterday, if we think that this is going to be something that we have to do over, like a yearly kind of review. And I really don't think so. I think once we get it up to date, it'll be nice to like look at it yearly to review, but I don't think it'll be the revamp that I think we're looking at right now, because I think it's so out of date. So I think once we get it up to par, I don't think it's necessarily going to have a lot of adaptations from year to year.
Any more comments, questions, concerns? Thank you, Lisa and Penny. Next, we have social emotional subcommittee update.
Hello, so I just popped into the chat our presentation from our last committee meeting, which was December 9th, if I believe so. And so basically we took the opportunity to really provide some guidance around the difference between social emotional health and social emotional learning. We went through some of the standardized tools that we're utilizing, the BIMIS we've used in the past and we're continuing to use to screen for social emotional and behavioral functioning. We have introduced the SECA, which is a tool for assessing social emotional learning skills, and we are piloting that with grades 5 through 12 this year. And so we went through just the two different tools that are trying to support us in the ability to gather data, and then really moving in the direction this year of having a data digging tool that schools can utilize to really guide the work based on receipt of the results. And then we also reviewed just the concept of anchor standards and really the alignment of social emotional learning in the district to actual the 5 CASEL competencies, and then in turn the anchor standards and indicators that are reflected through RIDE. So really trying to make the connection that there are numerous ways to measure social emotional functioning and social emotional learning. And it's really important that we do utilize, in addition to observations, more structured tools to gather information. We also reviewed some of the resources that we created internally. So we have an intranet site for staff with a number of resources for social emotional support. We have a parent guide that's gone out. So if you click on the link to that PowerPoint presentation, it'll have some of those components listed. And then we just talked about some of what we've done with the funding from Project Aware to support students' social emotional health and well-being and development. And that's kind of the gist. So if you have the opportunity to go through the slide deck, you'll be able to kind of reference and see a little more in depth. So we presented and then had a brief discussion.
So I don't know if it's because I'm on my work laptop and it's not letting me open things. But again, could at the end of, excuse me?
When you click, it won't let you open the Google presentation?
Yeah, there are 2 links that were posted in the chat. I've clicked on both and it says no access or whatever. So it might be because I'm on my work laptop, but I do think that these types of links and things like that, if we could just get them to either the committee through email ahead of time or include them in the agenda, that would be awesome, so that we could just, access them from wherever we are.
Right, thank you. Nope, and I heard when you mentioned that previously. I just thought I would share now since we were.
And it would have been great. It's just that I can't open it. I don't know if anybody else can open it.
So most of the time from PPSD emails, we only have them accessible to other PPSD staff. So I think, Dana, the best approach for us would maybe use convert it to a PDF or something else, or you can access, and that will involve Dana following up individually to grant access to anyone outside of PPSD. So I think the easier way is to find a different format that's accessible and we can send out immediately after this meeting so everyone can review it, because it was a great presentation. You really get a glimpse at how hard our social workers and Dana and her team work on a daily basis to meet the social emotional needs of our students. A lot is going on to address all of these different areas of needs, so that we are prioritizing our students and families' health and wellness. She's doing great work, and I applaud her for that because it's a huge undertaking. She and her team deserve a lot of credit for carrying this work on their shoulders and continuing to do so. So we'll share it out as soon as we can.
So I thank
you too, Peggy. You too.
And I agree with you 100%. She works very, very hard.
Thank you, guys.
Yeah, you can see she's still in her office right now, guys. You need to get home before this.
She should not be in
I'm trying to wait for the meeting, and I'm like nervous. Like, please don't let the snow happen before the meeting ends.
Yeah. So we'll share that out as soon as we can, and I urge everyone to take a look at that presentation.
Awesome. Any comments, questions for Dana? Okay. Last but not least, physical health and nutrition.
Sorry. Let's see. So we, at our last meeting, we're basically working with Kelly on refining and figuring out what the metrics were and how the reporting was going to go. So this is a first time out. So thank you definitely to Kelly. It's been a lot of work, and this has been a long time getting here. And we are trying to figure out sort of what the structure of our committee is, so we can make sure that the committee sees, and has a chance to preview the data and everything like that before she's giving her regular report to all of you. So we're working on that and on our scheduling. For physical fitness, Solite, there was a goal that I know that they were discussing on physical fitness. Could you give an update on that?
So, yep, there will be an upcoming Professional Development Day on January 25th. It's a statewide PD opportunity, and we are trying to work very hard with Karen to get that on the agenda for our district. We are offering the Rhesus Rocks in Rhode Island training for elementary schools, which will be a formation of existing schools, elementary schools, or even new ones who want to learn more about this program. It has been adapted to a virtual model as well, given the current pandemic climate. So on January 25th, that will be accessible to all of our educators, not just our health and PE teachers, but to any school that is interested in having a program at their school. It touches a lot on fitness activities, a lot of social emotional components as well, the importance of learning and playing together. So we're excited to do that. We are trying to also figure out something for the secondary schools. Linda Grassi had mentioned being interested in the box program. I'm not sure if we'll be able to get that in time for January, but it might be an opportunity for secondary schools in a future PD as well. The other thing, though, I wanted to quickly mention regarding the metrics is that our subcommittee did meet and realize that since we meet on a bi-monthly basis as a district health and wellness team, it doesn't actually align to what we had thought we would present as quarterly metrics. So moving forward, we would like to propose that these metrics not be quarterly, but be bi-monthly metrics based on the highlights that this subcommittee chooses to present before our district health and wellness team. So it will be a culmination of at least 2 months review by Kelly. During the summer months, we'll kind of do an end of school year review, as well as talk about the plans for the summer meals programs and what is coming up for the school year that is preceding it. So that might be a change in our schedule moving forward.
Just because we realized that we'd been talking to Kelly about a quarterly report, but these meetings being every 2 months, the schedule never lined up. Like every time she was going to report, it didn't line up with the data she was collecting. So that's why we decided to make that change.
Can I just ask, so one thing, Kelly, are you going to be able to, because that was really a great report and it would be nice to look at it a little bit more detail, and for all of us, especially I'm on that subcommittee as well. So are you going to make that available through Solite or send it as a PDF following this?
Yeah, I'll convert everything to a PDF. I didn't really get a chance to share it with the subcommittee ahead of time. I just quickly shot it over to Rachel and Solite, but if they think that's fine, then I'll just PDF everything and can send it to Solite for distribution.
Okay, that's great. And I agree. Yeah, if we can have it on the agendas with links, that would be great for things that are going to be presented prior to the meeting. So thank you for that. That's terrific. Question for Solite. I know we've been working, and thanks for your cooperation with that on getting the Recess Rocks training available again to any staff person. So when we said there are 10 schools that have gone through the formal training, but this is open to any school because quite frankly, right now, with the number of kids distance learning, these, what will be covered in this 2-hour workshop will be really helpful even for classroom educators on how they're going to keep kids focused, give families ideas for, again, getting the kids active because we know they learn through play. We know how important that is that they're being active. So the title is The Power of Play, and I think there'll be a lot of strategies and resources really for anyone who's working with elementary age students. But Solite, I know you gave me kind of a tentative time, 11:30 to 1:30, just while I have you here. That's great, but I wondered, that's kind of right over lunch. Is that how will the people who take part, will they have a lunch break before or after, or?
So they'll probably find a way to give the lunch break after or during. I'm not sure yet because it is virtual, but this was something that was decided. Dana might have more information. This was a discussion with the elementary network about when they can do it, because we have in the mornings these mandatory PDs that our schools need to take. So this can only be offered later on. Dana, do you have information on that?
Yeah. So we have a number of professional development days that are solely dedicated to providing and participating in professional development. But because we operate in 2 different networks now, the time frame and timeline is maybe slightly different from elementary than it is for the secondary network. So it's super important that we defer to the superintendents over each of those networks for the time frame, because that is the time they're allocating for any particular presentations. So if that's the best time, the lunch will have already been integrated into the schedule because they're providing us the times for presentation. Same thing for me. They provide the times and then I build the professional development around the times that they give me.
Okay, perfect. So again, just to clarify, so that they would have had lunchtime before or after. Because it is an active engagement. And so I just felt bad if they thought they could sit at their desk and listen to, just view presentations. So I just wanted to tell the trainer no. So they will have had, everyone needs their time to have off for refueling. So I wanted to make sure on that. Okay.
Right. And because they're in a union, they, it's organized so that it reflects their schedule. So they have their 2 15-minute breaks and lunch per their contract.
Okay, that's great. Thank you. And then one last thing I just wanted to make notice of, which I did at Dana's recent subcommittee meeting for social emotional, but because so many Providence educators and staff joined us when we hosted Dr. Mark Brackett from the Yale Center for Emotional Intelligence on November 16th. And at that time, he referenced a free course that would be made available, Managing Emotions in Times of Uncertainty and Stress. And I think for the people who joined that webinar and were able to witness the kind of work that Mark and his team does, and many of the Providence, certainly social workers, were familiar with him. So I think that there could be a lot of interest in this, but subsequent to that, the governor's office and RIDE actually worked with Yale to cover the $49 fee, which is to get a certificate for this course for educators. And I don't know, it seems to be taking longer than what they had anticipated to get that information out. So I just wanted everyone to know that if the Yale Center had already pushed this out, but for Rhode Island educators, it is going to be a rolling registration, and they'd be able to continue to take part. It's a self-paced online course through June of 2021. So if you know any educators who are interested, I'd say still kind of wait to register, because why not have RIDE pay for it if you don't have to, because I know they won't be able to give reimbursement
if you had already sent that. So we're just waiting. It's supposed to be any day now that they're going to make this announcement, and I'm sure they'll push it out in the commissioner's field memo, but I just wanted people to know that now so that they don't go ahead and register and then find out, oh, why didn't anyone tell me that RIDE was going to cover the fare?
Great, thank you. Any more comments, questions, concerns?
I have a question for Dana. Do you know if PPSD is participating in the Unite Us referral system?
Yeah, so right. So right now we're still in the process of working with our RPA folks and our that conduct and manage our data sharing information. So whatever system we have, we always have to have an MOU in place or a contract in place, something in place, a data sharing agreement in place. So last go at it, Marco was working on what it is we would need in order to move forward with that and make it eligible for people to access. So I think the challenge is that we have to platforms and resources and things come about, but we have to also ensure that we're following our systems and procedures so that we're accessing something that we've actually all have in writing and agreed upon and know what data and information is being shared. So I would put it in the bucket of in process. They were able to meet with him directly, which was probably more helpful because that is not an area of expertise. Like I can do implementation, but I cannot do kind of logistics around data sharing and those components.
Got it. And then my other question is, do you know what's happening right now currently around safety planning for young people? So the referral system, if somebody's worried about somebody, not necessarily that they're saying they're going to harm themselves, but just that they're worried, are there tools that are being shared with teachers?
For teachers, so our social workers are who would manage and support safety plan development. And so they would be case managers and coordinators as well as our guidance counselors. And so we do have a template that we use in order to guide some of that work. We also have a formal district safety plan also available that's part of our actual district documentation. And then we're using, the SPI process that's adopted, statewide and district-wide. And so we're still following through that assessment. And then depending on the disposition, after the student's been assessed, then we're determining whether it's a safety plan development, whether it's a school-based referral, whether it's a community-based referral, whether it's a visit to the hospital. So there's constant coaching around that, and that is their area, of specialty. So they either may have a district-specific safety plan, or they may have one that we've used that's a bit more young people friendly, that really just kind of is more where the kids can utilize it just as much as the adults that are referencing it.
Perfect. Thank you for sharing. Because I know a lot of our older tools were identifying red flags, but not necessarily in this world. Everybody's got those red flags, so it's really hard to determine. So thanks for sharing that.
Yeah, and I can't remember if we mentioned this before, Sarah, but we did. Is Sarah still here, Dinklage? Sarah? Yes. No, maybe. Yes. So I wanted to,
Yes, I am. Sorry.
You want to talk a little bit about the fact that you received the funding from the governor and we were able to get our MOU up and written and our folks ready to go into schools?
Yes, and I just wanted to add to what you said in response to Lisa's question. And, Dana knows this, of course, that this has been a partnership with the district, the Suicide Prevention Initiative, with Bradley Hospital, KidsLink, and Rhode Island Student Assistance, and all the social workers, psychologists, and school nurses. I think guidance counselors get trained every year in the suicide prevention, which includes that protocol with KidsLink and calling. So the Unite Us is an additional new, exciting thing that's been added, but while that is going through the process, your district folks are able to use the existing suicide prevention initiatives. It's still in place with KidsLink. In terms of student assistance counselors, yes, we did receive funding from the governor's office, some COVID-related funds to expand student assistance counselors into 6 new schools in Providence, and to fund 2 existing programs that would have run out of funding at the end of December. And so we will be adding 6 new schools. Some of those counselors have already started, and the rest will come on board January 4th. And yeah, we're really excited. For those of you who don't know, the Student Assistance Program is a substance use prevention, early intervention program, and a mental health promotion program, and places specially trained master's degree level counselors right in the school, embeds them right there to work collaboratively with the existing support team, including the school-based clinicians that may be on site, but to provide individual and group counseling for kids, and school-wide awareness and classroom presentations. And we've been in partnership with the district since 1987, and this at one point we were in every middle and high school, and until the federal dollars had been cut, and so we had to shrink way down. So this was a great opportunity to when the governor approached us about wanting to add services in Providence, especially now.
That's amazing.
Yeah. And the turnaround was great. And so we're excited. We looked that up like within weeks. So
Congratulations.
Thank you.
Great, thank you. We're right at 6 o'clock. I know I have a school board meeting at 6:30. I don't know if other people have meetings at 6. Any other questions, comments, concerns? Are there any announcements that anybody would like to make?
I just want to make a quick announcement. We had a meeting last week with Day One, and they are doing free trainings for adults and for young people, and they have a lovely menu of options. They also have some trainings for parents. So I just encourage folks who may want to take advantage of that to get in contact with that team there, Derek Lynch and his team, because they are willing to go out and provide free professional development sessions. So for our next PD day, I've booked them to do a session on gender identity for our social workers and psychologists. So I think it's awesome that it's free and available. So if folks are looking for professional development, reach out to Day One.
Thank you so much, Dana. Hi, I'm Jamie from Day One. I'm going to be sharing with everyone our training menu, so you can take a look. And if you want more information, just please let me know, and we'll be happy to meet with you over the phone, Zoom, whatever you guys need. And I'm also interested in joining the Healthy Relations Committee.
I have a quick announcement, which is that after 2 years of super hard work with Solite and Sodexo and many teachers and all other folks, we finally completed the Providence Public School District Farm to School plan. So I'm putting the link to the plan in the chat right now. I think, Kelly was great to share that local procurement data with us. And I think a lot of folks just don't even know that there's a lot of local food that goes into Providence schools. And so this is sort of a plan that's around all kinds of things around local procurement, around serving local food in the cafeteria, around teaching kids more about growing and producing food, and about supporting school gardens. So it's a really super huge document. The action steps are outlined sort of in the first maybe 7 pages. It's really huge. But our next steps with that group of teachers and other stakeholders is to sort of take all those action steps and figure out how we can tackle them over the next 5 years. So I encourage folks to take a look at that and share it, or just, if you have any curiosity about that process, let me or Solite or Kelly or anybody else know.
Thank you, Rachel, for all that work, and Solite. I'll also just note quickly, since everybody's a captive audience, Ellen mentioned it in the chat. Aaron also mentioned we have added over 400 home deliveries every Tuesday and Thursday that have breakfast, lunch, dinner, snack for 7 days a week that the Parks Department is distributing. And they'll also be participating in our 13-day mailbox. So now it's 13 days of holiday break that's covered in those boxes that are going out.
And thanks, Kelly. I'll add one more thing to that. If folks know students who want deliveries, they can call 311 and get added to the wait list. So 311 is the city's Mayor Center for City Services phone number. 211 is United Way. 311 is the city. So we are hoping to expand even further, basically as many rec vans as we can get on the road that can hold multi-day boxes. We're working on it. So thank you. Okay, so unless there are any other announcements. Nope. Okay. So I have a couple of comments. One is scheduling. I'm going to be working with the school clerk to get us on a regular schedule for the 2021, what's left of the school year, and also probably the calendar year, just for, to get everybody on the same page. I'd also like to ask that for those of you that have regular meetings already set up, if you could get those to me somehow, either given to Sene or to Solite, or just share them. I feel like there's a lot of information that we share in these meetings, and I always feel like I'm not gonna remember all this stuff. So either, I don't know if we can set up some sort of listserv or some sort of Facebook group or Slack or some sort of collaborative tool where as things happen, we can post it there, we can share opportunities, documents, etc. For the sake of transparency, I think that anything that is discussed at these meetings, if there's a report or some sort of outcome or some sort of resource, it needs to be on the website for other people's reference. If there's a parent that wants to know more, if there's a student group, a community member, if there's a teacher that wants to know more, so that they, so they can have a place that's more accessible, that all this information is more accessible. Because as I think you would agree, we have so many great things happening in Providence, but sometimes it happens in silos and everybody knows the information, and then, folks go without. So again, if you have any, all of these great reports and links and opportunities, if we can get them, harness them and put them somewhere that is accessible to us internally, but also accessible to the community externally. And so going back to my original part of the statement, I'll be working with Sene to schedule out, and Solite to schedule out the meetings for 2021. If you and your subcommittees already have a schedule for 2021, please let us know so I can put it on my calendar. I work in higher ed, and a lot of my work happens in the evening hours because I work with students and young alumni. And so that 4 to 6, 7, sometimes 8 o'clock time, I'm working, but I can make time if I know ahead of time. For the sake of transparency, I am going through a reappointment process. My second term technically ends at the end of January. I have applied for reappointment, and I'll know more by February. So hopefully, if things move along the way that they're supposed to, there won't be any interruption in the chairship of this committee. But I know that you guys are going to forge forward regardless. So I thank you for that. I think that's it. Sola, do you have anything else? Nope. Okay. Alrighty then. So it's 6:07. I'm calling the meeting to adjourn. Do I have to ask for a vote? Okay. If somebody could.
Motion to adjourn.
Thank you.
I second the motion.
All right. So Kelly and Lisa, thank you so much. Have a good night. Be safe tomorrow. Be safe through this global pandemic that we're still experiencing. I hope that you and your families are healthy, in health, and also in good spirits. And happy holidays.
Thank you, Nari. Happy holidays.
Thank you.
Thanks, everyone.